people take a lot of stuff for granted. Simple things such as walking, exercising, being able to stand for work, all that stuff seems like just a normal thing to be able to do until it becomes a problem. And so being able to help people navigate conditions that limit those activities has been beneficial, and it's been an enjoyable part of my professional life.
I love being an orthopedic surgeon. It's a fun job. It's very rewarding. We have a good group of guys that are working together towards a common goal, to work hard and figure patients' problems out and then watch them get better. They come in with a limp and they walk out without a limp. And we allow them to get back to their life with their spouse, with their kids, with their grandkids, and have a more quality, fulfilling life. That's the best we could ask for.
OrthoAlliance is basically several different practices that have come together really to join forces so that we can take the best care of patients possible. There's people in the group, whether it's hand, total joints, trauma, spine, you name it. If it's something that obviously I'm not going to treat as a foot and ankle specialist, then we can refer to one of the partners/experts to evaluate that and get it treated.
Joining OrthoAlliance has really expanded our footprint. Now we have multiple colleagues who have expertise in other areas that we don't, that are focused on that one specific element of care and treatment.
Maybe there are some specialists that really specialize in one area where a patient needs more help, and our group doesn't provide it, but we do have, in the great umbrella of OrthoAlliance, somebody that does take care of it. And I think that really makes it easier for patients to see the right specialist.
With Orthopedic Alliance, we get this whole host of partner practices that we can team up with. So if we don't have the right specialist for you, we're going to get you to one of our partner practices that has a fellowship-trained surgeon that specializes in what you do. We're going to communicate with them back and forth, and that allows for a more cohesive, more streamlined approach for the patient.
What that means for a patient is that they'll still get the individualized care that we've always offered for over 80 years. What our partnership with OrthoAlliance is, we've just now have a more robust program of physical therapists and specialists to rely on to get you to the correct doctor that you need for your specific ailment, whether it's any part of the body, foot and ankle, spine, shoulder, hip, or knee. We got you covered.
Well, I think from a patient standpoint, they should have the confidence that if they come here, we should be able to take care of the majority of everything that they potentially would need. But just in case they have something that's a little bit more complex, we've got someone within our organization that we can send them to make sure that they get the care that they need.
A lot of the colleagues that we rely on have actually become part of OrthoAlliance. So the patient knows that, if we don't take care of it, I can get you in front of somebody that I completely trust to take care of the problem.
OrthoAlliance is a very unique set of physicians. We have all specialties, and additionally, fellowship-trained physicians within those specialties as well.
There's specialties for hip and knee surgery, foot and ankle, hand and elbow, shoulder. And so when you look at most of the surgeons, even in ortho-neuro, and then across the board with OrthoAlliance, you have a unique group of orthopedists that have really the next level of training that comes with the fellowship training.
When you're looking for an orthopedic doctor, it's helpful to look for somebody that's been specifically trained or had a fellowship training in the area of what you're seeking care for.
You want to learn everything there is to learn about joint replacements, about shoulder surgery, about hand surgery. You do a fellowship. Fellowship is a one-year, super intense training program where everything is focused not on the entire body, but just that one body part. So if you have a fellowship-trained surgeon, you can be rest assured that that person specializes in all of the things that you need for that body part.
These are surgeries that are going to last you a lifetime. Joint replacements, you may be getting in your 40s, 50s, 60s, and even in the last 30, 40 years. You want someone that's doing 700, 800 to 1,000 a year, not someone that's doing one a month and just dabbling in a bunch of things.